there's this thing that has been there for a while. I know you are still practicing, or sorry, you are still learning to go out there to practice. It is going to hospital, and at times the treatment, not even at times, most of the times, the treatment some nurses give to patients is uncalled for. I know the doctors, I don't know whether doctors are aware, but most nurses, when you go to hospitals for treatment, the way they behave, they treat you, the attention they give to you, and all that, especially when the doctors ask them to come and treat you or take care of you and other stuffs. As we're celebrating this day, which our health is one of the core things in living a good health or a good healthy living. What do you say to this? I'm sure you're aware of this thing. What do you say to
I have
it?
heard.
Yeah. But I've having to experience
I have
one.
heard. I have not really. But is it? We are in a human environment. Like it's a human institution. All right. So people would have diverse behaviors. So the fact that you've met one particular nurse who has behaved like that doesn't mean all other nurses are like that.
Yeah, that's what I said
I have
some, not all though.
So I have met. I personally know some nurses who are very very good. Some even
Exactly.
go the extra mile of using their pocket money to look after patients, and definitely, and even it doesn't really have to do with the nurses per se. Some patients too, when they come around, the way they talk to the nurses is very bad. We understand you are sick.
Prince, are you trying to back your people or
I'm
what?
not backing them, or I'm not backing them. But
Okay, you
you see, sometimes
finish
we
making your
understand you are
point.
sick. We
Sure.
understand you are sick, but when you come, at least you should be considerate in the way you talk to nurses. And then people come from their homes with all sorts of problems. So when you do some of those things, it triggers a lot, but it triggers some things to happen, and that is when they get to talk to the patients like that or treat them like that. But considering all these things, I will not say it's the right thing to do. So in the hospitals, I have seen superiors who try to talk to some of these nurses to change some of those attitudes when patients come to complain. So though some of these things happen because it's a human institution, because we accept the fact that, oh, we are all human beings, we can make this mistake and that and that and that, but then it doesn't mean it's the right thing to be done. So our superiors keep talking to the nurses, and it's not just with nurses. There are other health workers. Doctors
Exactly.
are not excluded. So they keep talking to us to be able to change our behavior and then give the best to the patients that come to the hospital.
Good. Just a last take on this sub topic. So you see, you were making a submission saying that at times to the way the patient also fine. I know a few of the patients also go beyond to also talk to them anyhow, but I've also not seen or experienced a patient talking to the nurses anywhere, unless maybe the nurse does something or treats the patient in a way. And talking about the patients, you see, when you are sick, not necessarily pampering you, but you see, you will not be spoken to as a normal, healthy person. Stand up and come here. At least you need to do a bit to be able to allow the patient to succumb to what you're doing. If it's injection you're going to do for the patient to do, but when you come outright and you just shout on the patient or maybe feel as if the patient is not supposed to be something, it becomes awkward. And to finalize on it, there's a friend who I interviewed on this program or this project that we're embarking on, who lost his twin due to this inhuman treatment or um, caring of patient by nurses. He lost their sister to it. So when you're looking into it, it is not the best, as you have also admitted the fact though, and you're saying you're talking to them. So this World Health Day that we are trying to draw attention to promoting our healthy living and other stuff. As I'm saying, just trying to finalize on the issue of the attitude of some, not all, some nurses and the way they treat other nurses and all.
You see, with the issue of patients, nurses, health workers, doctors, and all those things, as I said, we are all human beings.
Yeah.
Yeah, so definitely we might get to have some issues sometimes with
But before
each
you
other.
continue, are you saying we are all human beings on the basis for others to continue doing what they are
No, no,
doing?
no, no, no. I'm not saying that. What I'm trying to say is that some of these things happen because people have their own personality. So what you might tell me and then I might take it so cool. You might tell some other nurse and then the person might not take it so cool. But then, as you said, you are sick. in our care, we are supposed to pamper you, treat you like a baby.
In a way,
In a way.
not
So
pampering. Yeah,
they talk to us, and so when some of these things happen, they educate us on it, and it's part of the whole medical school and then a nursing training. They educate you on some of these things that you are supposed to expect when you are dealing with patients, and not to flip to the other side of the coin and then talk to them anyhow. So it's not the best practice, as I said. So we'll definitely do our best to give the very best to our patients.
that we'll be expecting. We
Okay.
were expecting.
Okay.